Great. Just have to send a text. Perfect. So what are we talking about today? So today we are actually joined by some colleagues from the community tracing collaborative who will be joining us to talk about contact tracing. And we're really glad to have them here with us today. We're really doing that mainly because we feel like as we welcome more students back into our schools, we want to be ready to support them. We want to make sure that we know really the ins and outs of contact tracing in the event that we have the need to identify more contacts in our schools as we have more students in our schools. So we think this is just a really good time to go back over the role of the CTC and to talk about contact tracing. And so we're really glad to have two of our colleagues from the CTC join us, and we'll get to that kind of first thing in our meeting today. And then we'll go on to talking about, just like I mentioned, some really positive findings about the data from our initiative. What do we know about the prevalence of COVID based on the pooled testing results? And then, I think a really, great message of us being able to fund this initiative through the end of this school year. Then we have a few implementation updates to go over with you. Next steps, and as always, time for questions and answers at the end. So feel free to begin to put them in the chat if there are questions that you're bumping into, problems that you're having. We're glad to hear what they are. We're glad to do what we can to support you in all of our webinars that we have all the way through this school year. So let's look at contact tracing, and really pleased to be joined by two of our colleagues, Dr. Molly Dunn and Taylor Brock Fisher from the Community Tracing Collaborative. And let me just check to see if our colleagues are here, because we could always come back to this at the end of the agenda as well. Molly and Taylor, if you're here, if you want to take yourself off of mute and turn on your video.
Russell, I don't see them in the chat yet. We might need to shift this to the end.
Yeah, that's fine. No problem. In fact, kind of glad to go to the great news that we have at the end here. And Lauren, would you mind just emailing them to see if...
Yep, on it right now.
Thanks so much. All right, so our really important news for today, and we're so glad to be sharing this with you, that the data and funding updates, just starting with the data. What do we know about pooled testing as a result of now having done it for these many weeks here in the state because of your great work? We've conducted more than 22,000 pooled tests across the state at all grade levels. And as you can see, the results are at around 0.8%. So less than 1 in 100 have returned positive results. So a very, very low number of those pools are showing positive results. And when we think about it at the individual level, what does this mean for the individual? Because as you know, a pool has approximately 10 samples in the pool. What about the individuals? Because we're averaging about 7 swabs per pool at this time. What we know is that the number of positive individuals is very likely less than 2 in 1,000. So again, I think what this really tells us is the mitigation strategies that you have in place are very, very effective. The data are telling us that our schools are safe for our staff, safe for our students. And if there was any change in this, it helps us know maybe any adjustments that we need to make to those mitigation strategies. But again, this very low number of positive individuals helps us to see that everything you're doing is paying off for really keeping our schools safe places for learning. I think what's also great news about the data is that the pool tests are turning around, the results are turning around very quickly. So we're looking at about a 21-hour time frame for when the tests are coming back to you. We're monitoring that really closely with the vendors. Really appreciate their work in turning it around quickly. Appreciate your work on acting on it quickly. And we're being able to just make sure that we get information to you as quickly as we can so that you can take those appropriate steps for the low number of individuals who are showing up as positive. So again, thank you for all the work that you've done to gather these data. And now we're just glad to report it back to you. What's also important to know is that what we're planning to do is to now post more details about the pool testing results on our website. We'll likely do it kind of in a similar location on our website to where we're posting the positive cases that are reported to us from within our schools so that we can kind of see this information side by side. So we look forward to having that for you most likely later this week. And we think these data are very important and look forward to hearing what your thoughts are on them and how you can then use statewide data to compare to what's going on in your locality. So again, great news on the data. Thank you for all the work that it's done to get this information for us. Now let's talk about the funding. We're really excited about being able to announce today that we're going to continue to cover the costs of pooled testing through the end of this school year. And so we know that the Biden administration has made about $270 million available to the state to use for testing in schools. And that money, that's part of this, but it continues to be the support from both DESE and our partners at the Executive Office of Health and Human Services to fund this initiative until those federal dollars also kick in. So, state support and federal support coming together to make sure that on your end for schools and districts, you will not have to do anything about covering the costs of the types of services we have in place right now through the end of this school year. And what I also think is good news about it is that any of the procurement steps that you would have had to go through, just the contracting, any of the, getting 3 quotes, you won't have to do that. And so I think that's really good news. I hope that's something that supports all the work that you're doing. One less thing for you to have to take on. There are some steps you need to take. I'm going to go over them in just a second, but it's not nearly as detailed, not nearly as intensive as it would have been. And I think even more importantly, you can use the dollars that you had thought about spending on this for other important services for students. So we're really glad that we can make this happen. We haven't announced yet what this means for summer school, so we will provide an update on this by the end of May. But for right now, just know that for this school year, we are making sure that we cover these costs as you know them right now. So let's dig a little bit deeper on this topic. You know that we went out to find vendors that we would pre-qualify off of a statewide contract. And so on the left-hand side of the screen, you see those who we have successfully awarded status of being pre-qualified vendors to. So we have CIC Health, Ginkgo Bioworks, JCM Analytics, which is a new vendor, Project Beacon, Quest Diagnostics, also a new vendor, and Veritas Genetics, also a new vendor. So those are the approved vendors, the pre-qualified vendors that both districts and the state can purchase off of the statewide contract for. And so what we are doing now that we're saying that we're covering those costs is that the state now has to issue a request for quotes, just like essentially you would. Our rules are similar, not quite the same as what districts have to follow, but they're pretty similar. That we now have to ask for a request for quotes from that list of vendors, who's on the left-hand side of your screen only, right? Those are the only vendors that are pre-qualified. So now we go to them to ask for them to show us more about some other questions about their costs and whatnot, just like you would, so that we can determine which offer the best value for the state-funded program. So that's the process we're following right now. Again, for the vendors, I think this is also good news because they'll go through this once with the state for the remainder of this school year instead of having to have this type of process with each district in the state. So there'll be a kind of one time that we will very soon, like this week actually, be going out to ask the vendors to show us some more information, a lot of what they've already shared with us, but just a little more detail to respond to an RFQ about which offer the best value. We will then select vendors through that process. So of the 6 vendors that you see on the left-hand side of the screen, all of them might be approved through the RFQ process, through this next stage, but it might not be all of them. It could be 5, it could be 4, it could be 3. We don't know yet. We're entering into that process right now. We anticipate that, obviously we want as many as possible, and for us to select for our contracting with to continue to provide services for you. But here's a really important thing. If we don't select a vendor from the left-hand side of this screen that you want to work with, you could actually purchase their services just like you would off of any statewide contract. Just keep in mind that we won't cover those costs of working with that vendor. So the pre-qualified list will be posted. Any district can purchase directly off of it. It's not what we recommend because we hope that you will stick with us paying for this service. And we will do it. We will announce very soon, and I'll tell you a little bit more about it in a minute. But we will announce who those pooled testing program providers are, who we are selecting to continue forward with. And we'll talk in a second about that, how you will respond and select the vendor that you want to continue to work with for the rest of the school year. But again, I just want to reiterate, we have to go through another process with the vendors you see on the left-hand side of the screen. They are all pre-qualified. You could purchase their services if you want, but once they go through our RFQ process, we will then be ready to make sure that we communicate to you who those vendors are and how to select them for your district as you continue to go forward. So let's talk a little bit more about that matching process that I just talked about. So we will release a very short survey in mid-April to facilitate that matching service and the matching process. And that will be very similar to what we did at the launch, but much less intensive. So we're not going to have to get all the information we gathered from you, particularly districts that are already participating. But we will need to make sure that you have a chance right now to let us know who do you want to, if you're working with a vendor, do you want to continue to work with that vendor? If you want to perhaps switch vendors, we'll ask for your list of preferred vendors so that we can make sure that we match you in time in order to continue on with these services after April 18th. And we'll talk to you a little bit more now about both the districts that are currently working with a vendor or districts that maybe want to join this process who are not currently working with a vendor. And I think in bold there at the bottom, it's just really important to remember that when the time comes, it'll be just a couple of weeks from now, we're going to be back out asking you to complete this survey. It'll be very important for you to complete. That's the one step you'll have to do, but it's a key thing that you'll need to do to continue to participate in this initiative and have the costs covered by the state. Just that survey will keep you in the program and keep the costs covered by the state as we go forward. So let's talk about the districts that are currently involved. So we have, 181 school districts right now, schools and districts, when we include, charter schools, approved special education schools, collaboratives, and school districts. So that's who I'm speaking to right now. Those of you who are currently in our pooled testing program, we want to know kind of when this survey comes, there'll be different options for you to be able to respond to. So one option would be to express your preference to stay with your current vendor, and then you'll be matched with your current vendor. You might, another option for you, if you're currently participating in our program, would be to express the preference to change to another vendor selected through our RFQ. And then we'll ask you to rank your preference of vendors, and we'll match based on those preferences. And then finally, if you decide that you want to work with a vendor who's not on our list selected through our RFQ, like I said earlier, you could purchase those services from vendors, but the state won't actually cover the cost of those services. Let me just pause right there for a minute, thinking about the districts that are currently involved in our pooled testing program. I'm assuming that's most of you who are in our meeting right now. And Lauren, Jeremiah, Sean, anything I missed there, anything you want to add? All right.
Covered it.
Feel free to chime in if I miss anything whatsoever. So let's talk about the districts that are not yet participating in our pooled testing program. There are districts that we're looking at a couple of scenarios here. There are districts that maybe want to join in now, and we hope that they will now that this is being funded. We hope that you will join in and participate in our state program. And you would, through our survey, through the survey that we'll put out in mid-April, a little earlier than that, actually, let's say, around we're looking at somewhere between like the 9th and the 12th, likely to have this survey up, that you would express an interest to begin this process and work with one of the vendors that we have approved through our RFQ process. And you will rank your preferences, and we will match to the best as possible as we can based on the preferences that you've noted to us. And then there could be districts who aren't in our pooled testing program right now, and want to work with a vendor not included in our state RFQ process. And again, if you're one of those districts, you could purchase the services from one of the 6 vendors that we've pre-qualified right off of our vendor list, right off of that state contract list. But again, state funds will not cover those services. So I hope that's helpful in terms of what to anticipate in the way of survey that we will be releasing soon. We'll make sure that we have another webinar at about the exact same time that the survey becomes available. We'll want to make sure that you know that it's there, answer any questions that you have about the survey. We'll walk you through the survey just like we did the last time so that you can see what we're asking for, make sure that we answer your questions about what we're asking for. It should be a very streamlined process, and it'll just work to keep this initiative going in your district as seamlessly as possible as we move further into the month of April. So glad to answer any questions in the chat when we get to the end. But let's go on to a few implementation updates, just so we can tell you about some of the key things that are happening based on some of the questions you've asked of us, based on some of what we've seen in the data. And really the first thing that we want to start by talking about is increasing parental consent. We know that a lot of districts have done an amazing job of getting this program set up in their districts. You have the supplies on hand, you've done the trainings, and you've worked with your families in a lot of ways. And yet we still need to get more families invested. We need to get more families involved. And so what we want to be able to do is to talk to you today just about some ideas about the messages that maybe would work, maybe what we're hearing about from other districts, some ideas that we have. But we hope that some of the messages that might really resonate with families is just how simple it is to participate. Families that haven't signed up yet, I think we've worked through a lot of the consent issues that we ran into about the various places and ways that people need to consent. And so now I think consent is as easy as it's been throughout this entire process. And we have some good communication strategies from our partners at the Shaw Foundation on the covidtesting.com website. Would encourage you to go there and look at some of those messages that we've prepared for you that Shaw has gathered from other districts about just how easy it is to participate. And this message of it's really helping us keep our students, staff, and families safe. And love the idea of kind of the layers of protection that we need to see in schools, hopefully sharing them the data with them, the data now that we have, maybe being able to talk about the data as an indication of how well the layers are working, the ways in which the pool testing can really help us so quickly detect, trace, and isolate positive individuals so that we can really lower transmission and allow for more consistent in-person learning. We know that message really resonates with families. Really wanting consistent in-person instruction. And so we just hope that, this idea of how much this is helping to facilitate that is a key message. And that, this really maximizes the safety of in-person learning. And then finally, really focusing on that it's quick, free, and voluntary. And I need to hone in a little bit more on this message about the program being voluntary. This has been our message all throughout the beginning. It's not painful, it's not invasive, but it is voluntary. And we are hearing about some districts saying that it will be required for students to participate in order to come into the school for in-person learning. And we've had this actually in our FAQ for quite some time now. This isn't new at all. This has been really from the beginning. This has been from the beginning that the participation is voluntary, but strongly encouraged. And we can't keep students out of school if they don't participate. And so we're hearing some things, and I like the idea, for example, of going to student athletes, to going to student musicians, going to student performers, whatever kind of extracurricular is particularly motivating for students, and saying, we're strongly encouraging you to participate. We really want you to participate. This is important for this team. Let's just imagine a sports team. We really need you to participate. But at the end of the day, if a student says no, that they won't participate, you can't keep that student out of in-person learning. And you can't keep the student off of the sports team, because sports are a part of the school experience for our children. So we really want to stress this idea. There's a tricky balance here of it's voluntary, but we really want as much participation as possible. And so getting that buy-in, getting that message of why this is important out, we hope will help with this. But we do want to, just really, stop this idea that there's a requirement to participation in pool testing in order to gain admittance to in-person learning. And we just want to, kind of prevent any problems that you could have down the road with that, because we do think it's not a message that DESE would be able to stand behind with you. But again, voluntary and a great way of really supporting our children and our staff in our schools. So some other ideas that we have about increasing consent. We want to, some ideas about just how we can involve parents, students, and staff. We're thinking about the ways in which teachers and faculty members maybe could, be doing kind of proactive outreach, very active outreach, affirmative outreach to families to encourage them to participate. We know how much parents really trust their child's teacher. And so asking, if a teacher had a message, an individual teacher had a message to the students in their class that the teacher really values participation, that could help. So just an idea, not all our ideas are good ideas, but we think that this could be one that would resonate with families. And then the idea of student ambassadors or parent ambassadors. And we heard about this in the last meeting when we had, our 3 guests from the district speak about the ways in which students in particular can be very motivating. And again, that idea of the sports team or the, student performers or, groups that are really buying into this, that have made it a commitment among themselves to participate, we think is great. And so the way in which you might be able to encourage more students to be able to participate by hearing it from other student leaders within the building would be great. And parent ambassadors. Parent-to-parent communication could also be very strong, written in very parent-friendly ways, very encouraging, kind of building excitement around this could also help. And then finally, I won't go through all of these resources here, but we think that there's some great videos out there and great resources that could also help to spread the word and help families to get on board with this opportunity for their children in our schools. So I hope some of these ideas help. Thank you for staying at it. I know it's you've already done a lot of work around obtaining parental consent, but keep at it. And let's see if we can't get those percentages to keep coming up and up and up as we go through the rest of this spring. So a couple of other quick things to discuss today. We have some updates about the use of Binex now. And so keep in mind that there are kind of 3 uses of Binex now, 2 of which we're very familiar with, symptomatic staff and follow-up testing for pooled, follow-up testing for pool testing, follow-up testing for pool testing. We're going to talk more about close contacts down the road, not today, but just know that this is coming. The use of, or actually we are talking about it today. Lauren, can you just let me know if I'm off base here?
Yep. We are not talking about this today, but we will in the future.
We are not talking about this today, but it is coming. Here is our kind of prep for the next meeting.
We are talking about the Binex, yep, the travel advisory. Keep going.
Yep, let's go there. Great.
Right there.
Perfect. Thanks, Lauren. So we've had questions about whether or not Binex now can be used for staff and students returning from out-of-state travel. And we just want to be clear that no, we actually don't want and can't endorse Binex now as being used for students and staff who've traveled from out of state. And so, it is only approved for symptomatic staff and students, follow-up testing for pool testing, and then we'll have more about close contacts coming up at our next meeting. So this is just a preview of what's to come. And we always want individuals returning from out of state to follow the guidance outlined in the travel advisory. So a couple of other things that we just want to talk about today are just the updated documents. And so we've updated our documents just to make sure that this piece about the travel advisory is very clear. And hopefully that will help as we continue to go along. So with that in mind, I think, again, key takeaway from today, really positive information about the pool testing results. very positive information about the state continuing to cover the costs of pooled testing. We'll get to your questions in a minute, but right now, why don't I just check to see if our colleagues from CTC are here, and we will. There's Molly. Hello, Molly.
Hello, I'm here.
Thanks so much. Let me go back to those slides real quick, and we will be glad to take over from there. Molly, thanks so much for joining us. And if you just want to let me know when to advance the slides, that would be great.
Sounds good. Thanks so much for pivoting. Apologies about the tardiness. You know how it is with virtual life. All right, so my name is Molly Dunn. I'm the Deputy Director here at the Massachusetts Community Tracing Collaborative. I also have my colleague Taylor Brock Fisher on as well. He is the Assistant Director for the Outbreak Investigation and Response. Many of you know that as the EIU, so he's also here, happy to answer any questions that you have, specifically to outbreaks at K through 12. So next slide.
Yep.
Great. So just wanted to review a few things. Probably a lot of it you are already aware of, but just in case. The Community Tracing Collaborative works under the direction of the Department of Public Health and also in partnership with local health departments here in Massachusetts. So all of our protocols here at the Community Tracing Collaborative are based on CDC guidance and of course DPH directives. So the information shared with cases and contacts is the same that has been established by the DPH. So we cannot and will not alter our advice from what's already being disseminated by DPH in their guidance. CTC receives records from the local health departments electronically only after individuals' test results are sent to Maven. So it's then the local jurisdiction's choice to whether they want to send or can send the cases or contacts to the CTC. So they either elect to continue working on it at the local level or they send it to the CTC to do the case investigations. And as we all know, there are times when schools may become aware of a test result before the CTC, but just we wanted to make sure that you understood the pathway in which how we receive records and when we work with them. Next slide, Russell. All right. So the CTC communicates directly with public health nurses, health agents, and health directors about cases in their jurisdictions. We're not actually set up to work directly with the schools, but with that said, the CTC is certainly here to support schools by amplifying the work of the local health departments, and we'll always defer to local health in how we are supporting the school systems. Next slide. So I think we just wanted to go a little bit deeper into that just to provide a little bit more explanation to that. So the CTC is only authorized to share protected health information with local health departments and the DPH. So we ask schools to work directly with health departments' points of contacts if you have any specific questions. Schools are permitted to share health, like COVID-related health information with your local public health department. I know that we've gotten questions about that in the past, and if you want to look into the March 2020 U.S. Department of Education FAQ document, it really outlines specifically what information you can share with the public health department, when and what types of information. So I would highly recommend taking a look at that after this presentation if you haven't already. The CTC can obtain information from the student or parent guardian to share information with school health officials once we receive this information from local health departments, but we are not authorized to divulge any information about a case without the consent of either the case, say for instance, staff or teachers, or the guardian parent of the student. So we just wanted to make sure that everyone was clear on that as well. Next slide, Russell. So we wanted to go over a few different services that the CTC also offers. Like I just talked about earlier with Taylor Brock Fisher, we do have the Epidemic Intelligence Unit called EIU at the CTC, and they are here to assist with notifications and tracing related to classroom exposures, youth sports, social interactions, and any other situations that can lead to outbreaks within your K-12 system. So should the local health departments, schools need assistance, they can reach out directly to the EIU. We do have a specific EIU email, as well as a direct line to the EIU, which is outlined right here for your convenience if you would like to ever reach out with any questions. Next slide. Some pointers that the EIU would just recommend. It's really important, if you can, to maintain information like seating charts, pod organizational charts, student schedules, and rosters for sports teams. This can really help speed up contact tracing. So just having this information before you find out about an outbreak is really important. And of course, providing this information to local health departments or the CTC can really ensure that the students, faculty, and staff are notified about any exposures in a really timely manner, which of course is the ultimate goal of stopping transmission as soon as possible. Next slide. The other program that we have here at the Community Tracing Collaborative is the CareReese Coordinator team. So this team encompasses people with backgrounds in social work and public health, and they're really here to help people cope with coping support and connections to resources in their local communities. Specifically, the resources to help individuals and families be able to isolate and quarantine effectively. So we know that students and families here in Massachusetts some may not have the ability to isolate and quarantine safely without these additional resources. So collaboration between schools, local health departments, and the CTC can really help ensure that students and families get the support that they need during these difficult times. Next slide. Last but not least, we just wanted to put a little pointer out about continued vigilance around infection control. It's certainly crucial, especially even right now. We've been dealing with this for a year, and we definitely can appreciate that people are impacted by COVID fatigue. We know it's very difficult to enforce these measures day in and day out, but of course, messaging about social distancing, mask wearing, sanitation, and avoiding high-risk activities is really the most reliable way to stop the spread of COVID-19. So just continuing the vigilance in the school environment is really, really essential to help protect your schools and your school staff. We recommend continuing messaging to your staff and faculty around infection control as what I just outlined above. Other things specifically about like safe carpooling and cooperation definitely is key with contact tracing as well. And with that, I will close. Thank you so much for giving us a few moments to just discuss CTC. And again, I have Taylor here too to answer any questions about EIU too. Thank you.
Great, thanks so much. Thank you, Molly. Thank you, Taylor. We are getting a few questions that are coming into the chat. And so why don't we just start with some questions about the quarantining and kind of CTC related, and then we'll go to questions about the other content that we've presented today. Molly and Taylor, one participant writes, I often get calls from the CTC regarding cases in the district, and I'm told I don't have permission to share the name, but I'm letting you know that there is a case in one of your schools. This isn't particularly helpful. And so just kind of wondering about the purpose of the call. Any feedback on, when a school gets a call from someone from the CTC and they can't identify any information about the individual who's tested positive, anything that could be done differently, or any feedback that you would have on the purpose of the call?
Yeah, and it's definitely a great point, and kind of what I was alluding to earlier in the other slide. We have to have permission from the parent guardian in order to disclose information about a student. So if they do not give us permission, we cannot disclose that to the school contact. We can, however, alert the school that there has been an exposure. The information is at the local health level. So we do also notify the local health departments. So we would encourage you to reach out to your local health department contact to be able to communicate further on that.
So when you get that call, calling the local board of health would be an advisable thing to find out more information, to get that information directly about the individual student. Now, just to remind people that the link that Molly referred to earlier talks about the ability under these emergency circumstances associated with COVID for school districts to be able to share information, personally identifiable information with their local boards of health. So really that's where you can share the personally identifiable information. It won't be with the CTC. So all the more reason for keeping that strong connection with your local board of health. A question about when a parent tests positive, when does the period of quarantine start for the student? So does the quarantine period start after the parent's 10-day isolation is over, or when does the quarantine start for the student if a parent tests positive?
It's a great, no, it's a great question. And there's a little bit of nuance there because it depends on how you can separate in your household. If you are able to 100% isolate away from children, so you're not sharing any kitchen space, bathroom space, bedroom space, then potentially your isolation, their beginning of quarantine would be the last time that you had exposure to them. However, if you have any kind of continued exposure to your children in your house, then the quarantine would actually begin on the day that the parent is released from isolation.
Great. Thanks, Molly. I appreciate that very much. One comment about the calls from the CTC is that that's actually kind of anxiety producing maybe for the school nurse to get that call where personally identifiable information can't be shared. And so for the CTC, perhaps just to speak with the local board of health could be helpful, because then the local board of health could contact the nurse in this example with all of the information, not just some of the information. So just a comment from one of the participants here today. Also some concern about some challenges of getting through to the local board of health being expressed as well. So appreciate, the kind of full range of feedback that we're getting. And also just want to take a minute to introduce my colleague, Anne-Marie Stronach, who's also here with us today. Many of you have engaged with Anne-Marie around our protocols, around our reporting positive cases. And so I just want to mention that Anne-Marie is here and is also supporting so many of our efforts that relate to all of these issues and answering questions like this about quarantining, about the protocols. So thanks, Anne-Marie, for being here today. So a couple other, before we get to any of the funding or data related questions, we're getting now kind of bridging to just other questions that sort of relate to the work that we're doing, and sort of just asking about why should staff who've been vaccinated continue to participate in pooled testing? Some hesitation from staff members feeling like, I've been vaccinated. Why do I need to continue to be in pooled testing? And so I would just start by saying that, I think that we just all have to, continue to do our part. And, this is such a key piece of it that, as we learn more about, we understand vaccination, but transmission is still something that we want to know more about in the way of how COVID works. And so we would just encourage staff in the way that we all want to keep our schools safe, is to just have them participate in the pool so that we can just understand the extent to which, somebody who's vaccinated could potentially test positive, could potentially be, have a viral load that we just wanted to know about. And we hope to be able to evolve this and have this change over time as more people get vaccinated. But for right now, we're at kind of a bridge point, and we just want people to continue to work on getting vaccinated, but to be part of our pools at this time as well. And I just wonder, any of my colleagues from CTC or HHS have any further comments on that?
I think you said it exactly right, Russell, is that we understand the vaccination pretty well, but we don't yet fully understand how that relates to transmission. And hopefully, if you're in a classroom that's already doing pooled testing, adding that one extra swab is a small step to take to try to keep everybody safe.
Yeah. And so another question just about, if a staff member who's been vaccinated is part of a positive pool, do they have to quarantine and get a negative test before returning to school or work? Jeremiah, we know the answer to that. Why don't you take that one? So go ahead.
No, it's okay. Please do it, Russell, because I don't remember.
Oh, it's all right. Yeah, no. So, I mean, we're not saying if you're part of a positive pool, you never have to stay out. It is not our advice that you quarantine if you're part of a positive pool. Our advice is that you come into school, that you get tested. Binex now gives us the results within 15 minutes. And so the part of this question that I would just change and evolve is to say that, we don't recommend that staff or students who test positive remain out of school, predominantly because if you're symptomatic, you need to stay home. All right. But if you're asymptomatic, then you would be in school anyway. And now we have a way of finding out you are part of a positive pool. We need to do this follow-up quickly. And so we wouldn't ask that we have individuals stay out if they are for anyone part of a positive pool, much less somebody who's vaccinated. Great. Let's see if just some other questions that are coming up. Also, actually, one person had a good comment about how important it is for vaccinated staff members to just model for their students that they're participating in pool testing. So I thought that was a really good point. Just also watching for the variants as well. And so just an important thing to continue to participate in pool testing for. Let's go to some questions. Let me just check the time real quick. Oh, we have plenty of time. Good. All right, let's go to some other questions about some of our announcements today. Oh, sorry. One question, Molly, about the CTC. Is there any cost associated with using CTC?
There is no cost in using CTC now.
Great. All right, so for the services that the state will continue to provide through the end of this year, courier services came up. And so will courier services be covered? Jeremiah?
Yeah, if you're participating in the state-funded program, yes, they will.
Great.
And I would add, Russell, that also goes for the whatever in-school support you're coordinating through the state program as well.
Great, thank you. Lauren, we've been asked about district-specific questions. Could you just remind people of the email address to send questions to here at DESE?
Sure thing. I'll put it in the chat, Russell.
Great, thanks, Lauren, and thanks for that question. So a question about when will we know whether our current vendor is selected? It was a lot of work to get the program up and running smoothly, and there will be some work involved in adapting our protocols for a new vendor. So keep in mind that we want this to be as seamless as possible. We know the importance of, if you're working with your vendor, we want you to be able to stay with that vendor if that's your desire. So we will have this survey available for you. Like I said, somewhere in that vicinity of the 9th is a Friday, the 12th is a Monday. That's the target date for us in terms of what we're working towards having that survey available. Jeremiah, Sean, correct me if I'm wrong. But those are the dates that we're looking at. So we just look for your speedy response on that. That's going to help us keep this as smooth as possible. The survey will not be intensive, will not be near the work that it was to get started with this program. This was new for all of us. There are, building something new into a school during the school year. We know the challenge of that, but maintaining what you're doing, we want to make as stress-free as possible, particularly if you're wanting to stay with your vendor. So we think that, we know you need to find out as quickly as possible. We will work very diligently so that you have that information and just can continue on without any kind of interruption of service leading up to April 18th and after April 18th. But Jeremiah, anything else to say about the timeframe and expectations around timeframe?
We are working as hard as we can to get that done. We know that that's very important to you. That's very important to us too. And I do just want to clarify. So there are 6 vendors who are pre-qualified through the RFR that the state had open, and all of them need to respond to the RFQ that Russell talked about earlier that the state is issuing, that EOHHS is issuing soon. And it's hard to tell exactly where we're going to get back from that, but we need to make our decisions based on what we get back, and we are going to make those decisions literally as fast as we can.
Definitely. So Lauren, some questions about using Binex now for close contacts. So again, we're just giving you a preview today that this is coming. We haven't settled on exactly the procedure to follow. So more to come on that, but Lauren, anything else that you just want to mention about what's coming?
No, I think that's right. I think we are just putting a pause on that for right now, but we will have more information to share at our next webinar.
Great. And so a question about the how the funding will work as the state continues to cover the costs through the end of this school year. Is there funding available to cover the administration and record keeping associated with testing, or is funding just to pay for testing of pooled samples? So keep in mind that districts that have needed that, what we call tier 2 support for either administration or oversight purposes, we have provided them during the early launch, and we will continue to provide those services through the end of this school year. And yes, there are responsibilities that the district has to pick up as well. We're not, saying that there aren't certain duties that the district still has to cover and, frankly, pay for through the use of their staff. But we've really tried to cover, the vast majority of the costs associated with pooled testing. Jeremiah, any other thoughts on covering costs and what's covered, what's not?
No, I think that that's right. And anyone who's been assigned to a vendor has a pretty good sense of what they can and cannot coordinate. And you're exactly right that they're never going to get to 100% of the work that has to be done to get this to work at a school. And I think we're all very appreciative of kind of what is left on the table for you all. And we're also appreciative of the fact that you're really the driving engine of this work, and we're just trying to build the car around it.
Yeah, absolutely. Well said. Thank you. Molly, back to you, actually. Really appreciate a question from a participant right now asking about how quickly the CTC follows up on when they get a close contact, when they know that they have a list of close contacts. What's the turnaround time like at CTC? And because I think the basis of this question is instances where school and district leaders need to know that a list will be called before the next school day. So before those students enter the building, what's the turnaround time like?
It's a really great question. And I will say, usually it's within 24-hour turnaround. Obviously, there's nuance to that, with increases in cases. So I always like to put an expectation there that there's always a possibility that it could go over that. But I want to turn it over actually to Taylor to also address like another way in which we can also help with that from an EAU perspective.
Yeah, thanks, Molly. Yes, so as Molly said, there's definitely some nuance and kind of depends on the broad turnaround time, but on the EIU, so again, that sub-team that really focuses on these outbreaks when we have lists of people that need to be called, we have the ability to kind of really put priority on those lists and get them called kind of as quickly as possible. Additionally, we have ways to collect lists securely. So if you do kind of identify a group of people that need to be notified rather quickly, and of course working with the Board of Health, the EIU specifically can support in sort of securely collecting that list and making sure that they are called with a certain priority to get them notified before the next day of school.
Great. Thanks, Taylor. Thanks, Molly. A fairly specific question, and we know that this happens though in the state, where a school nurse is also a public health nurse and works for the health department. Can the CTC disclose the positive cases names to that individual?
If they are a public health nurse and are working with the local health department, we work with local health departments, so that would not be an issue if they're designated and working with the local health department there within the school's jurisdiction.
Yep, great, thank you. Excellent. So a question about, and this might be one for us to look into and get back to you on, but Jeremiah and Lauren both thinking about, in times people, if an individual has tested positive, they can still test positive for up to 3 months after being diagnosed. And so how should that situation be handled?
All right, do you want me to take it, Jeremiah? We've actually said that individuals who are COVID-19 positive should not participate in pooled testing for up to 90 days. And then once that 90 days has passed, they can then participate again. So that individual should just follow the protocols outlined in our protocols for responding to COVID-19 scenarios, and isolate and quarantine based on that guidance, and return to school once they're clear to.
Great. And so Lauren, if a district didn't participate in symptomatic testing in schools, but they're now using Binex for reflex testing, for pooled testing, is there a way that they can get into, you know, the initiative for using Binex for symptomatic individuals? What does it take to do that?
Yeah, definitely. So for the path that you'll take is dependent on the current pool testing vendor that you're working with. So I recommend that that individual contact our testing email address so we can work with them individually and make sure that they have the proper consent forms to participate in the symptomatic program for Binex now. But yes, they could participate in both, and we actually encourage them to.
Great. And Lauren, that email that you put in the chat, the K-12 COVID-19 testing at mass.gov, that's the email address we want people to use, right?
Correct.
Great. Thanks so much. And so I had said before that here's a question we might need to get back to you on, and I was wrong. We already knew the answer. Let's try this one. Can pool testing detect the variants in schools? Is it capable of detecting all forms of COVID, essentially?
So I can't tell you that it's going to detect with 100% certainty that it's going to detect every variant of COVID. I can't say that. I can say that the labs that we've approved for use in this pool testing program are very good at picking up different variants that are known to us. And what's in the FAQs around, for example, I'm trying to stay at the right level of detail here. There are 2 nodes in the processing lab that runs on each sample, and sometimes one node will pick up a variant that the other node does not, and that'll lead to a particular kind of result. And if you follow our guidance on what to do, and if you get one of those kinds of results, you should basically be testing and retesting in that case, either with another pool or with follow-up testing. And that should take care of a lot of the variants that are out there. But again, I cannot sit here and tell you that 100% of the variations of COVID are covered in the pool testing. I can just tell you that we're trying to catch a lot of them, and it looks like it's pretty successful.
Yeah, and again, this is a PCR test. This is the gold standard PCR test. It's as good as any PCR test at detecting COVID. It's no different than an individual test in terms of what happens in the lab and the processing that occurs. Jeremiah, any thoughts about, you know, now that we hope to have even more districts sign up, any concern about the vendors being able to cover the influx of additional districts that might come on board right now?
I don't think so. I don't think so. We've been working with them quite a lot these last couple of months, and I think that they're kind of ready, willing, and able. And you know, it's not been a road without any speed bumps, but it's been a huge program that everyone's worked really hard on. Schools certainly included, if not at the forefront of that. And I think that anything that's in our way we can get through. And no, I don't think that as we get new programs, new schools starting the program, that we're going to see, you know, hiccups related to capacity. I think we've already run through a lot of those in the first couple of days of the program.
Yep, great.
Russell, I'll also just add to that we are hoping that with our pre-qualified list and our new RFQ that we will have more vendors than just the 3 that we're working with. And so we'll be able to make we'll have decisions about capacity and vendor selection based off of a wider list of vendors.
Great. Thanks, Lauren. So Molly, back to you. A question about that communication between the local board of health and the school district. This individual gave a shout out to their local board of health, said they're fantastic. And they just want to hear again, is it accurate that the local board of health can share personally identifiable information, but CTC cannot? Can you just reiterate that for this participant?
Yeah, and I like the document on the PowerPoint that I presented earlier that outlines what you at K through 12 can share with public health departments, and then it's under the local health department's purview of what they will share with you. I will leave that up to them. It's just as far as the CTC, we cannot share information beyond, you know, the person's name if we've been given that permission and their grade level to be able to conduct contact tracing. But anything beyond that, we cannot share with K through 12. But certainly, if you have questions or anything like that, you can discuss with your local health department and whatever they decide to share with you and what's appropriate. Obviously, with public health information, less is more. We don't want to share, we don't want to overshare information. So we just want to make sure that we're protecting privacy as much as possible.
Yeah, thanks, Molly. Appreciate that extra reminder there. Again, I would just take a look at that link that's in the PowerPoint. I know Lawrence put the PowerPoint in the chat, and use that link to the federal guidance on FERPA. If anybody's questioning you, feel free to show them that. That definitely that information can be shared with between the school department and the local board of health. Lauren, is it too late to sign up just for Binex Now testing?
No, definitely not. Both programs, pool testing and Binex Now, are open, and all of the materials to apply for either program are found on our website, and I can put both links into the chat.
Great. All right. 2 more questions and then we'll wrap up for today. So thinking about more students coming in for in-person learning, particularly at the elementary level, starting April 5th. Jeremiah, do you think the labs will be able to handle that many of the districts are going to have to be switching their testing days to Mondays, so that they are testing early in the week in order to catch positives? Any concern about more Monday testing going on in the state?
No concern about more Monday testing. I would say where possible and feasible, and if all other things are equal, it's better to spread that out through the day. Just because if everyone's sending their samples on Monday, I'm not worried about the lab capacity, but the turnaround time might go down by a little bit. But no, that's not something I'm worried about. I think, do the best thing for your school. And if it's even between Monday and Tuesday, do Tuesday. Yeah.
Thanks, Jeremiah. Appreciate that. Appreciate the work of our labs to be ready for our schools and to support us. And we've been in real clear communication with them about where we're heading. So our last question for today, if we think about the situation where a student is home because they're sick, but the weather's becoming better, and we could maybe set up Binex Now testing outside of the school building, would it be possible to have a student come to school, go outside, go to an outdoor location on the school grounds to get Binex Now testing, or should they go someplace else to get testing? So can the school offer on-site somehow Binex testing that's not inside the school building if they wanted to for students? I guess my thinking on that is to be extremely cautious. It's hard for me to sort of endorse bringing anybody who's symptomatic onto school grounds. It's hard for me to kind of endorse that in any kind of way. I'd say that, that's why, making an appointment to go elsewhere would be important. We just really don't want transmission inside schools. Again, though, I could be wrong on this. Glad to hear from other colleagues who might see it differently. But particularly if you have a symptomatic individual, I think that's different than someone who's been identified as a close contact coming on site, perhaps for the kind of remote testing that you have. So I would suggest extreme caution, but and I know we have any other colleagues here who want to kind of chime in on this one.
I think you're right to draw a line at symptomatic individuals, and I think kind of it looks very different on either side of that line to me also, for whatever that's worth. And I would just say with any testing that you're doing outside, just be mindful of the Binex Now's temperature thresholds for testing, which are on the product insert and also in our FAQ. Great.
Well, thank you everyone for being here today. I hope that the news that we released today is good news for you. And I hope that you continue to do this great work. We appreciate everything that you're doing to ensure safe learning spaces for our students, for our staff. Thank you to Molly and Taylor for being here with us today. Obviously, a lot of questions that I know you helped to answer today. Just really helps to keep the work going. Wish you all just a great spring day and look forward to seeing you the next time we get together. Take good care. Bye-bye.
Thanks, Russell. Great job.